Welcome to The Big Unlock, where we discuss data, analytics, and emerging technologies in healthcare. Here's some of the most innovative thinkers in healthcare information technology talk about the digital transformation of healthcare and how they are driving change in their organizations.
Hello again, everyone, and welcome back to my podcast. This is Patty, and it is my great privilege and honor to have as my special guest today, Mike McSherry, CEO of Zelt. Mike, welcome to the show.
Thank you, Patty. Thanks for having me.
You're most welcome. So, Mike, tell us a little bit about Zelt and the Zelt platform and what need it addresses in the marketplace.
Sure. So Zelt allows clinicians to easily prescribe digital health to patients, then for patients to consume, engage with the program or service or device that has been recommended to them, and then bring the patient's utilization and compliance with that program or service back into the clinical workflow for the physician to monitor the patient's engagement with that solution for improvement in care. And, to date, what we've seen in the market is clinicians typically have three options for a patient. Take this med, go do labs and imaging, or go see a specialist. And we believe there's a fourth category of a range of digitally facilitated services that span from transportation to devices to educational, prep and recovery, to apps and programs managing a chronic care disease state. And we aggregate and easily allow clinicians to use those as care treatment offerings for their patients.
That's great. Thank you for the background. So, Zelt came out of Providence St. Joseph, and your initial investor was also Providence Ventures, right? And importantly, first of all, I must congratulate you on your recent round of funding, and we'll talk about that in a minute. It seems to me that you have chosen not to raise money from your typical Silicon Valley VC, but you've stayed with strategic investors who are also in many cases your customers, such as Freighted Health and the Cleveland Clinic. Now, I'm sure that many brand name VCs would love to invest in your company, but can you talk to why you chose to go the route of strategic investors and not your VC community?
Yeah, sure. So we were incubated inside of Providence. Providence out here in Seattle hired myself, and there were four of us as entrepreneur in residences. So you can almost think of that as with the idea that we'd come up with an idea and spin it out, and they would be investors if it were a clever enough idea and validated and be deployed and utilized within Providence system. So Zelt is actually my sixth startup I've co-founded over the last 20 years. And every single one of them has been a joint venture, or the first money in has been strategic. So I have a propensity for working with strategic investors as, they help with customer validation and reference ability. And, along with their cash also comes the credibility that they bestow. No, we were thrilled to have Providence St. Joseph, participate in our funding. We were actually incubated inside of Providence, going back about 3 years ago. They invited myself and three of my coworkers in as entrepreneur in residences. We've done a number of large tech startups, and Providence thought that bringing some new energy and creativity in healthcare could potentially be valuable. So Zelt is actually my sixth startup that I've co-founded, and every single one of them has involved strategic investors as either JV partners from day one or the first investors into the companies I've created. So I've got a propensity for working with strategic investors. And UPMC had come along to see what innovations Providence was working on, and we had incubated the Zelt idea and launched a prototype inside Providence. So when UPMC saw what we were doing, they said, boy, if you can show that working in our Epic environment, this is exactly the type of company we'd want to invest in and utilize. So we proved to them how scalable Zelf's deployment could be within their Epic environment, and that led to us spinning Zelf out of Providence. And we did get a Silicon Valley VC, DFJ, to lead the round. But then also importantly, I got my first 4 Epic customers to also invest in Zelf. And that's Providence, UPMC, Freighter, and Hennepin. And then more recently, we closed an additional round of funding with a number of key strategic partners, McKesson, Novartis, Philips, and ResMed investing. And they represent different channel opportunities and business partnerships for things that Zelf can prescribe. And we also brought in several new provider investors, that being Cleveland Clinic, Atrium, and Memorial Care. So we think that helps validate what we're doing as a platform level opportunity within healthcare, and bringing all these large, highly credible industry players in as reference customers and channel partners solidifies that opportunity for us.
Right. And briefly, what was the recent round that you closed? Can you tell us what the numbers were?
Yeah, sure. It was $14 million. And so we're thrilled with that to give us the next runway for growing Zelf, deeper into other provider systems and bridging into more different digital pathways and therapeutics and devices that we prescribe and monitor for our provider.
Right. Okay, so Mike, so let's talk a little bit about how the platform actually works, because that's, I think, of great interest. You have an interesting new model. So let me start with this. How do you actually recruit digital health startups for your platform? Do you curate them on behalf of your customers, or do you just sign up anyone who meets a certain minimum qualification? What kind of assurances do you actually provide to your clients, like all the health systems, about the startups that are actually on your platform?
Yeah, no, great question. So we often say that we're managing the digital health formulary for the hospital system. So we don't choose the vendors, the hospital system does. And the hospital system has BAAs with these downstream vendors, that govern their use of PHI information. And so we only integrate vendors that provider customers deem relevant for their patient care. And we easily embed them into the prescribing workflow and through to the patient portal engagement, and then round tripping the compliance and utilization and dashboard view of that engagement with that downstream vendor. So we've launched over 30 different vendors with our provider customers. And again, these are only supporting what clinicians believe are relevant for their patient care. Now, we are capturing a lot of aggregate data on engagement, measurement, ultimately outcome level effects of these digital solutions against patient compliance and disease management. And we do believe that we're going to have a pretty powerful benchmark of what digital therapeutics work best against what patient populations and segmentation. And it's hard to imagine that in digital therapeutics, there's going to be a one-size-fits-all. You're going to find age, gender, ethnicity, language, pref, all playing a role as to what program or service represents the best patient care in chronic care management.
Right. So, Mike, you mentioned digital health formulary, and we've seen a couple of other companies getting into that game, more specifically Express Scripts, that also launched a digital health formulary, which is targeted at health plans. And they're also curating the digital health startups, and they're making recommendations about the startups. Now, all digital health startups have a fundamental challenge with the payment model, because unless we're in a predominantly fee-for-service environment, and getting reimbursed for a digital health solution is a challenge. And when I look at a platform like Zelf or any other platform, it potentially increases the costs for a health system that is contracting with a digital health company. And how do you make the business case for a platform like this?
Sure. So our customers are the hospital systems. And again, we only integrate the vendors that they deem relevant for their patient care. And that's sometimes managing disease state, sometimes its goals are to build brand awareness, loyalty, patient education, think against maternity care information, highly engaged patient population. And sometimes it's to reduce the metrics that are relevant for a hospital system. So we're doing a lot of surgical pathways, and a lot of that is to prevent readmits and patient satisfaction, against high volume, ortho procedures, or, again, to reduce the readmit penalties. And we're doing lift rides against Medicaid surgery patients because it's cheaper to pay a $20 lift ride than risk losing a $10,000 OR booking slot. So the range of different digital solutions we can incorporate span the different business model needs of provider systems. But we're a cloud plugin to the EHR. And you referenced Express Scripts. So think of us as a SureScripts for digital health. And it's not always necessary for us to know that the hospital system is paying for the solutions. As a cloud plugin, we can also marry up to prior auth on digital health. So regarding the digital health formulary, we saw that news too about Express Scripts, and CVS Caremark also announced a comparable level of functionality. But our customers are the providers, and we incorporate the digital solutions they deem relevant for their patient care. And that spans a pretty broad range against their needs. In maternity care, it's often for, lifetime value for an expectant mother and converting the family into that provider system. Sometimes it's to prevent readmits and the penalties that can get imposed against surgical operations. We're doing lift rides for Medicaid patients. It's cheaper to pay a $20 lift ride than risk losing a $10,000 OR booking slot because of a no-show on a potential surgical operation. So the range of things that we can embed span the needs of a provider system and what they're trying to do with their patient base and patient goals and satisfaction. But we're also a cloud plug-in to the EMR. So think of us as SureScripts for digital health, managing the formulary for a hospital system. We are also prescribing Weight Watchers and Omada. And where we sit at a clinical decision support is, against a elevated BMI and the patient's not pregnant, anorexic, and bulimic, you'd never prescribe one of those solutions if those conditions were also co-present. But we're also marrying it up to the payer eligibility and looking at, is there a payer coverage for this asset? Therefore, it's a recommended solution for the patient in front of that clinician. So think that we'll increasingly do more and more prior auth on digital health solutions. And we have a couple of provider deployments where they have got ACOs and joint venture with payers that are paying for the Zelf deployment to increasingly put their solutions in the clinical workflow to be prescribed out to their member base. We're also prescribing Amazon products, and soon you'll see us stair-stepping into McKesson, who's an investor in us, whereby it's OTC consumer paid. So it's just easing the clinical efficiency of what they recommend to patients. It's easing the patient adherence and receipt of those products. So what we prescribe to patients via our solution span from provider paid to payer paid to consumer paid, and it just depends on the use case and what that provider organization is trying to do with their patients for easing and aiding their care delivery.
And so the business case for licensing your platform for the provider is that they get improved efficiency and some economies of scale, and that is the payback for the investment that they're making on the platform. Is that how you position it?
Yeah, exactly. Once you plug the Zelf infrastructure to a provider ecosystem, think of us as a power strip, and all digital vendors get plugged on top of us downstream from that. So we are typically integrating vendors in 1 to 10% the level of effort, at what was traditionally required to hard code those vendors into, Epic and Cerner workflows at a core EMR level. We're doing all of it at a modern API-based in a cloud infrastructure. And so, ease of technical deployment, IS integration, ease of clinical workflow and efficiency, and giving more toolbox offerings to clinicians to get the patients to do the aid in disease management and care recovery tools that are beneficial in patient care. We increase patient engagement and provide aggregate analytics of that utilization of these services. And we also do remote patient monitoring and compliance against these. So we're monitoring Philips and ResMed CPAP devices. We're doing glucometers. We're soon stair-stepping into EKG monitoring. So the more that you can remotely monitor a patient's engagement against where are they at in week 12 of a weight loss program? How are they doing with their glucometer readings? Are they utilizing their CPAP in an effective and frequent enough manner that it's beneficial for patient care? So with that remote monitoring and increased patient engagement, it also allows the providers to stair-step into a deeper risk arrangement whereby they now have more engagement and risk management of patient populations that they did not have previously.
So that's great. So there's a population health management aspect to it as well, it sounds like, because you've got all the data on the usage of the platform, utilization levels, engagement levels, and so you can identify care gaps and intervene appropriately and so on. So that's an interesting aspect too. So let me switch to a different question here. So, there's lots of digital health platforms out there, and there's billions and billions being invested, and at the same time, the success rates have been relatively low. And a lot of digital health companies are, more recently, they're just publicly going out of business. So, some of them are going out of business not so publicly, but there is a challenge. A lot of these companies don't seem to be reaching critical mass in some way. So how do you keep score in terms of where Xealth is, and what are the metrics that tell you whether your sustainability as a business is going in the right direction? How do you really track that?
Yeah, so we believe that we facilitate the increased adoption of digital health in provider care. So because of that complexity of integration to EMR workflows, a lot of hospital systems just never adopted digital health or digital care solutions. So we increase the utilization and engagement numbers of these solutions for providers. Where our metrics are, obviously deal cycles, how many large provider systems have signed up with Xealth, and we're either live or in contract negotiations with 7 of the top 10 IDNs in the country. So that's one metric that is gauging towards our success. But we also importantly track the number of prescribed or monitored activities that a provider system is doing for their patient population. Is it growing? Is it providing increasing value? Or are we showing demonstrable engagement and ultimately outcome metrics of what digital therapeutic or digital pathway solutions and what problems they're meant to resolve? And so, when I go back to our strategic investors, they're also investing in the point solutions. And, we've kind of come up with some phrase of stronger together because there are several point solutions that we've integrated to Xealth that are being launched at multiple provider systems. So we vastly facilitate the deployment and utilization of all these digital therapeutics into the clinical workflows. So as you referenced, a lot of these companies, are not quite showing sustained usage, sustained metrics and numbers. Most digital health solutions to date have sold to the payers and the employers, the capitated party, the one that truly carries the risk of that patient compliance and engagement. But I think they'd all like to be doctor recommended. That's the sweet spot of adoption and utilization and engagement numbers. And that's what we help to facilitate. And I think that the engagement numbers that we're showing, the vast uptick in utilization of being doctor prescribed or doctor recommended versus member marketed or employer engagement, is vastly superior, and that's where you're seeing the traction of the investment base, again, against McKesson and Philips and ResMed and Novartis on what we're doing.
Right. I think the doctor prescribed thing is so important. If you go back a few years, a lot of digital health companies thought that they could go directly to consumers, and started with B2C models, and they realized quickly that consumers do not trust applications that do not have a clinician's approval, and so they've all pivoted, right? And they've all gone to B2B because they know that there's no way to bypass the doctor and gain trust with the consumers. So I think that is a very, very important point, which brings me to the question of the providers themselves, right? So in our work, and we do a lot of digital transformation advisory work, we help health systems develop digital strategies and digital roadmaps. What we find is that a lot of health systems are signing up digital health solutions, but there's no sort of an enterprise-wide strategy as such. And each solution is evaluated on its merit, and maybe it's a departmental initiative, maybe it's a functional initiative, whatever the case may be. But it's a loosely aggregated set of digital health solutions that address a specific point solution, but there is no enterprise-wide strategy necessarily at a platform level or even at a roadmap level. So in that context, that's neither cost-effective nor scalable. In that context, what does it take for the whole digital health ecosystem to realize critical mass? And what role do you see Xealth playing in that? Well, firstly, do you even agree with that assessment?
No, one of the challenges to digital health, even the name of it, digital health. I mean, do you think when in banking, do they talk online banking strategy anymore? No, I think it's just their strategy. And does Delta talk about their e-commerce strategy? I think it's just called their retailing strategy. So the fact that we're even calling it digital health shows how far behind we are. It should just be the provider system strategy on patient care and engagement and outcomes. And we have to get into conversations around what their digital transformation is, and increasingly provider systems have hired chief digital officers and patient experience executives. And with that kind of understanding that there's a problem there, Xealth fulfills a needed capability, because if all you think is one vendor is going to solve a solution in my ophthalmology department, and that's the only sort of digital tool in my toolbox that I'm going to offer for the next year, you don't need a platform play like Xealth that aggregates a range of different digital options into one clinical interface. If you have a strategy that shows that digital is a part of an engagement strategy against patient populations, and there's a whole toolbox of solutions that provide better patient care, then a platform play like Xealth helps to aggregate and fulfill and execute that strategy for a provider system. And again, as I just referenced, we're working with most of the top IDNs in the country now. They're all showing that a platform level strategy of offering more convenient options for patient, more virtual options for patient, and meeting patients on the flexible type infrastructure that they live their consumer life in, and bringing some of that to a patient life is necessary to remain competitive. You have the threat of new entrants, what Amazon might do, Google might do, point solutions building infrastructure from the ground up. And with that threat and the need and observation that if they're not morphing into more digitally driven engagement strategies, they're going to become roadkill on the way that the market is moving around them. And so Xealth helps them execute and fulfill on a more platform level aggregation strategy of digital tools benefiting patient care.
Right. So that's actually a great segue to a question I was going to ask you about the big tech firms, right? And we know that all of the big tech firms, Microsoft, Google, Amazon, Salesforce, everybody has Apple, everybody has a stated strategic interest in the digital transformation of healthcare, and they're all approaching it from their own points of view. Now, one of the big challenges for most of these firms is that they have these big platforms and they don't necessarily have the last mile solutions, the point solutions, which you're aggregating under your platform, right, under Zelt. So in a sense, they're approaching the market as a cloud-based platform or whatever platform it is, and they really want to become kind of the de facto digital experience platform for the health systems that they work with. And the expectation is that all of the point solutions will sit on top of their platform, health clouds or whatever it is that they want to call them. But your model, on the other hand, is the exact opposite. You start with the point solutions that health systems have already invested in, and then you aggregate them under your platform. There's a fundamental difference in the approach to the market. So I guess my question is, what do you see as the first of all, the competitive threat you feel, if there is one you feel, with the big tech firms? And what do you think that's going to look like if one of these big technology firms were to prevail? And what would that mean for Zelt?
So that's actually the world that I come from as background. I used to work at Microsoft. I've co-founded several large tech and mobile companies, Boost Mobile, which is now Sprint's nationwide prepaid service. I co-founded a company, Swipe, which is a touchscreen keyboard that's been put on almost 2 billion Android phones. So I was very deep in the, quote, big tech world. And then I jumped into healthcare, incubating Zelt within Providence. So we're innovating from the inside out here on the observation that without integrating to clinical workflows, you get nowhere. And we just described that you want to be doctor prescribed. That's the ultimate goal of all these digital therapeutics, and that's what we're facilitating. So we deeply integrate to clinical workflow. We work with clinical governance at provider systems as to what they're trying to do beneficially for patient care. And that level of deep understanding of Epic and Cerner environments and clinical workflows and the triggers for relevant patient activity against clinical diagnostics is things that we've become expert in. And that is going to be a needed skill set that any of those big tech firms would need if they truly want to scale a platform level solution into healthcare. We have built our solution on top of AWS. Now, most large providers, even still, are on-prem EMR-hosted solutions. And we're the very first reason that several large systems did their very first AWS integration. So we're strategic to AWS at penetrating provider systems. We're prescribing Amazon e-commerce products, and that's facilitating clinical efficiency and patient experience. But that poses a threat to the industry incumbent, saying, "Hey, wait, why are you prescribing Amazon products? What about my retail catalog? I've been in healthcare medical supplies for decades." And so you go back to the patient experience and how do you improve that? And I think between what Apple is doing with the watch, I expect Amazon to get into more and more wearables. Google has wearable offerings, and to the extent that they hit a clinical relevance, whereby they're judged on their clinical markers the same as CPAP devices or glucometers or EKGs are, they're going to need something like us to bring it back in the clinical workflow to make those remote patient monitoring highlights and thresholds that pose risk interventions clinically actionable. Again, that drives back into Zelt. So I see us as the touch point back to the doctors and clinical workflows, that a number of both incumbent industry players as well as these big tech players will find highly valuable at scaling their cloud and platform and larger scale solution offerings into healthcare writ large.
Right. And I think if I read between the lines there, you might have just described your exit strategy, but you don't have to answer that question.
I think, again, I have 10 industry incumbents invested in Zelf, between, the providers and the McKessons, Novartis, Philips, and ResMeds. I am fulfilling a here and now need against a largely fee-for-service world, but as a cloud plug into the EMR that exposes the clinical workflow to payers, to e-com players, to pharma, is extremely valuable to new players and new business models trying to also play a role in healthcare and facilitating patient care. McKesson and Novartis both play hugely strategic roles in pharma, and they both invested in Zelf on how we can move to new digital supply chain capabilities. Increasingly, you're seeing FDA-approved digital apps replacing meds, and how do those apps get in patient hands, except for a solution like Zelf. So we see ourselves being relevant to a number of players that are trying to advance healthcare.
Awesome. So we're coming up to the end of our time here. I just have a couple of real quick questions. You came from outside the industry, Mike. So how does it feel to be in healthcare? What are your big one or two takeaways?
Well, I've had some success in other industries, so I wanted to try to take my skills and my team skills. We brought 12 people over from Swipe, my last company, into Zelf. So we wanted to try to tackle a bigger, more meaningful problem, and healthcare is still living in a lot of antiquated systems and needs to be modernized. So we're passionate about trying to build new experiences and new technologies and reduce the cost of care delivery in the U.S. I would like to see faster decision making exist in the industry and more risk tolerance to try new things. And I think you're actually seeing that with the fear of new entrants disrupting the status quo of healthcare, and that's a good thing because it helps the incumbents move even faster. And so I'd like to see increased acceleration of experimentation with digital technologies. So that's something that we're finding valuable and sort of a tailwind. And we're also hoping to build, kind of an aggregation strategy of large strategics, saying we're the de facto platform, and we want to be the digital health marketplace for providers on what's relevant and what's beneficial and in patient care, and that's going to be hugely valuable at facilitating a digital transformation in healthcare delivery.
That's awesome. So my final question for you today, Mike, is you've been a successful entrepreneur many times over. What advice do you have for digital health startup founders?
Know who's paying for your solution. So, follow the money. And I think that's, an oft repeated thread in jumping into healthcare. Be humble and listen to your audiences. And because we work so closely with providers and new to healthcare, they're the ones that increasingly say, what I have a problem with is doing X. And so we can find those solutions and build those into our scalable platform. So there are incredibly intelligent people in healthcare. Listen to them and try to help aid in their care delivery protocols that they're used to, but work within that environment to advance them into new skills and technology and capability. But I have found strategic investors to be, incredibly helpful at how we're migrating our business model, customer reference and validation, and advancing new business opportunities. So be humble, work with the constituent group paying for your service provision in the vertical segment that you've chosen to pursue in healthcare, and I find the investors that exist in that ecosystem to be hugely beneficial, versus some straight up financial dollars, seeking a pop.
Right. Mike, it's been such a pleasure speaking with you. Thank you again for coming on our show, and look forward to staying in touch and following all the success for Zelt.
No, thank you. And books such as yours, The Big Unlock, are helping me as a guidebook for other ideas and things to be aware of as we continue down this path.
I greatly appreciate that. That's so kind of you. Thank you again, Mike.
We hope you enjoyed this podcast. Subscribe to our podcast series at www.thebigunlock.com and write to us at info@thebigunlock.com.